On to the cancer drug Avastin. Bevacizumab was approved for the ovarian cancer indication. Why don't you please update us on that? I think it'd be interesting to put it in perspective. Was this just a progression-free survival type study, or was it more of an overall survival, and what was the Kaplan difference and so on?
Absolutely. As you all know, vascular endothelial growth factors are involved in tumor angiogenesis and aggressive behavior in many tumors, including ovarian cancer. So, on the other hand, we have Avastin, which is a monoclonal antibody against VEGF, and it inhibits angiogenesis. This drug has been approved for treatment in metastatic lung and colon cancer. And for that reason, the gynecologic oncology group have decided to design a trial to study this drug in addition to the standard therapy for ovarian cancer after primary surgery, which is carboplatin and Taxol. So what they did is they randomized ovarian cancer patients. They randomized approximately 1,900 patients to one of three arms. Arm one is the standard therapy, the control arm, which is carboplatin and Taxol every 3 weeks for a total of 6 cycles. The second arm was carboplatin, Taxol, and concomitant Avastin. And the third arm was carboplatin, Taxol, concomitant Avastin, and then followed by maintenance Avastin for approximately 15 months. The trial was designed to look at progression-free survival as a primary endpoint and overall survival as a secondary endpoint. They found that the second arm, which is carboplatin Taxol with concomitant Avastin, did not have a statistically significant improvement in the progression-free survival over the control arm. However, the third arm, which is carboplatin Taxol concomitant Avastin followed by maintenance therapy, had a significant improvement in the progression-free survival of approximately 4 months. So for that reason, this drug has been now in the process of being approved for treatment of ovarian cancer patients after primary debulking surgery in the adjuvant setting.
Will you start using this right away, or will this require some compendium approval for practical reimbursement reasons, or how's this going to change your practice?
These are preliminary data. It has presented in ASCO in the most recent meeting. There is a definite move to using these drugs right now in the adjuvant setting. I think there is an ethical kind of need to provide this drug, at least for the patients, and talk about it. It's not a completely harmless drug. It's a biologic agent, but it is associated with many side effects. So one has to weigh the risks and benefits. It can make a big difference with respect to the outcome of patients. In ovarian cancer, if the patients recur within 6 months of the last chemotherapy, they are considered platinum resistant. So they have poorer prognosis. They might not be eligible for more platinum drugs. However, if they recur after 6 months, they are platinum sensitive. We can repeat using carboplatin and Taxol on them, and these patients usually have better prognosis. Do we know if this is going to affect this situation? It is very difficult to say. And again, the trial was not designed to look or to comment on overall survival, but preliminary data showed that there is no improvement in overall survival.
Okay.
Ovarian cancer is one of those few cancers where Tom Temple, I'm a professor of orthopedics and pathology at the University of Miami Medical School of Medicine, and I'm the director and CEO of the University of Miami Tissue Bank.
Thanks.
Ovarian cancer is one of those rare tumors that where typically the tumor is sent for chemosensitivity studies. Will Avastin be placed in the panel of chemo sensitivities for this particular disease?
Once Avastin, and that's my personal view, once it is approved in the recurrent setting, I think it might be added to the panel because usually the chemosensitivity assays are done whenever the patient recurs and after multiple lines of chemotherapy. Do we know if there is resistance to Avastin? Obviously, there is, because patients that stay on Avastin eventually develop and resistance to it and progression of disease. Are they upfront resistant to it? I'm not sure that there is data to indicate that.
I guess a follow-up question is Avastin induces a fair amount of capillary fragility. And as you go back to reoperate some of these patients, many of these patients do recur, are you worried about bleeding problems in that population?
It's mandated that you do not or try to avoid surgery on patients on Avastin for a period of 28 days approximately. After that time frame, I think it is probably safe to operate on these patients again.